neurovascular and what we have to need to improve this field. The pediatric neurosurgery, I think it's one of the fields which is most practicing in Africa, and you see here one of the baby which was I operate with the first neurosurgeon in Congo Brazzaville, and now we know that all the neurosurgeons in this country dealing with all the pathologies. Stereotaxic and functional are already, of course, practiced in many countries in Africa, and we have the chance to add one of the diploma university certificate to training people even from outside of Morocco. So leaders should take care also of education and training. This is some guidelines of the local training program in LMIC countries. First, encourage local training cert. Secondly, stimulation of clinical research. And third guideline is organization and promotion of neurosurgery. We should encourage our young neurosurgeons to attend these courses with creating more scholarships provided by organizers, such as we always did in this African course. We have to pay tribute to some pioneer and who create such educational program, which is today congratulated by all the countries around the world, and may create and reinforce some regional exchanges between our countries. Thank you, Professor Khamlichi. And I will go back. I will fast quickly about that. You already mentioned this convention signed between WFNS and our Moroccan government. We are very proud of this WRR Reference Center, of course, and which is created in 2002. So I will go over that because already mentioned by him. So great opportunity is offered a good level of neurosurgery in some centers in the region and a driving force for the rest of the region, increasing interest of cooperation with the international community, development of the international network of training centers between organization and of neurosurgery at the level of the region, help provide support for the neurosurgeon, main actors in developing and promoting neurosurgery locally and in African and Asian and Latin American continent, and help development of neurosurgeon in our university. It's very important to improve it. So the issue is to develop exchange between neurosurgical centers in different countries, to create specialized department, either private or public, dedicated to neurosurgery, to develop cooperation with not only regional or international societies, but to be as one unique organization, and to create research center to develop a strategy to decrease the prices and makes neurosurgical material accessible, encourage medical financial support between different level income countries. And what are our challenges and perspective in different countries and continents? It's the last slide. For example, in this paper, Professor Khamlichi has shown you 2 or 3 papers published by himself, but here is this is a paper published by Usama al-Mafti in 1988, showing the low incidence of cerebral aneurysm. In the same period, a group of young neurosurgeons, as he said, dedicated to research about this subject under her supervision, and they conclude the incidence aneurysm is the same as he's shown yesterday. So how to build a sustainable long-term neurosurgical care capacity. I believe that the solution lies to development of additional regional WFNS reference centers for African young neurosurgeons, Algeria, Senegal, Egypt, South Africa, Nigeria, etc. And we should increasing the capacity of the pre-existing centers. The fundamental role is a continuing education with the organization of congresses and the courses like this one, as well as several seminars and workshops. WFNS Rabat Reference Center is a successful and very effective training model with the reduced cost. The projection for 2025 is to train an additional 80 African residents in 70 training centers in Morocco. The second important thing is assessment and replication of some local models for neurosurgical training and equipment acquisition. The Nigerian Sokoto experience is finally the role of CANS, and the National Neurosurgical Society is capital. So just I will show you the Nigerian experience with Nasero, who is trained in Rabat Reference Center, and now he is trained 14 neurosurgeons and project to train an additional 15 young neurosurgeons in the next 10 years. So the program has to be reviewed to meet the future need of neurosurgeon. Reinforcement of education and training in standard neurosurgical technique. Development of training in subspecialties. Development of training in minimally invasive technique. Development and implementation of socio-economic curriculum in neurosurgery residency program, healthcare management, medical, legal, social issues, development of neurosurgery simulation in residency programs, use of electronic media and internet for educational purpose, online, literature reviews, and etc. So, in conclusion, although neurosurgical capacity in sub-Saharan countries is increasing, sustainability is still at risk. The African neurosurgeon bear the vital responsibility for the development of neurosurgery in their countries. The lack of neurosurgeon equipment may be overcome by local solutions. Support of the international neurosurgeon community is important in education, organization, and equipment. Development of additional WFNS regional training centers is mandatory to build a sustainable long-term neurosurgical care capacity. So, just to tell you in conclusion, the leaders are also competent, and competence in its ultimate form requires perpetual assessment and reassessment. Leaders perpetually reflect. Finally, leaders are wise. Everything is possible when one is passionate. Thank you so much for your attention.
Thank you very much, Professor Labadi, for this wonderful talk, which summarized a bit what's going on in Africa, but in the world as well. And you gave even some indications of solutions. But we'll discuss that later on because we need to gain a bit of time. Maybe we would like to call the other team of chairmen to come and come here, and we carry on, and then we'll have questions and answers at the end of the next session.
Thank you, Professor Kazadi. As he said, we are short on time, and we have to leave the room at 5 p.m. for the preparation of the ceremony. So may I ask for the next session? It's continuing with the same subject almost of global neurosurgery. We are going to ask the colleague for the WFNS Training Center alumni session. They are here? Okay. So may I ask the moderator, Professor Khamnishi, Dr. Bouzouba, and Dr. Jimouh to come here for moderating this last session. Thank you.
Good afternoon, dear colleagues. Thank you to the organizers for giving us the duty to share this last session of the course. And I must to say that I'm very happy to chair this session as it's dedicated to the presentations of the colleagues, Rabat African alumni. And this session was traditionally started since we have the group of the first 5 years trainees who were already back. When they start to be back, then we started to create in this course every time one session to listen to them and to see how they are doing, how they are working, and what are their problems in their country. So today we are going to start this session with Dr. Abdullahi Jimouh, who is one of the first trainees who came from Nigeria and who spent some time with us, not 5 years completely training, because he was already had his basic training in his country, and who is here today is going to speak about a testimony on the WFNS Rabat Training Center. Dr. Jimouh, please. Comment maybe about the last session on education and global neurosurgery? Someone has, sorry, is there any comment about the last session? We are looking for some maybe time. Dr. Jimouh, if you have any comment on the global neurosurgery? Yes, Dr.
So thank you for the lectures. They were very interesting, and we really learned new things. I mean, as a resident in our practice, we have like 3 or 4 African residents coming from sub-Saharan countries, and it's really heartwarming to see all the work that has been done during those years to allow those countries to have their neurosurgeons. The one thing that I noticed is that there are no women coming from those countries in our department. I mean, in Casablanca, I don't know for other cities, but most of those residents are only men. While in other specialties, we noticed that there are women who come to do like neurology, hematology, and other specialties, but not neurosurgery. I don't know if the African women, sub-Saharan women, are not really encouraged to do so. I mean, I don't know what's the reason behind this. This is my first remark. The second one is that what are the efforts that are done to allow the Moroccan residents to do fellowships abroad? I mean, for those of us who want to specialize in a certain field, like in vascular neurosurgery, in pediatric neurosurgery, what are the efforts that are made by the different Moroccan societies to allow us to go and further in our practice? That's it. Thank you.
Yeah, regarding your first remark, we had 3, I think that we had for all 3 candidate women, which all were accepted. I have never seen a women candidate take her out. In the opposite, we gave priority to the women if they were there as candidate. But this depends on the candidates who are coming from different African countries. You know that the problem of women in neurosurgery is a great problem, as was mentioned by Professor Abadi. Morocco started just to have some. There is maybe 20 or 25, I think, no more. Algeria has more than that, maybe double. But this is the only countries where we have quite a good number of women. This is a problem if we were. So if you have a candidate, a women candidate, welcome. And regarding, I think, Dr. Wahabi will answer better your request regarding the fellowship.
Oh, first I will maybe add something about women in neurosurgery, because you know the number of the neurosurgeon women in neurosurgeon is increasing at least 100% from the three last decade, also in sub-Saharan area. You know, in the same time there is one meeting in Ivory Coast, and the president of this society is a woman. So can you imagine that in 10 years before there is no woman, or at least 1 or 2 women in all this region, and now we have another president of society. We had the president with the late Professor Saad Bakhti and myself as a president of society. So I think the main objective for women is to promote our specialty among the women. And when you have a pioneer or a senior in this specialty, and you know, to do something for the juniors among us, it's very important. And about the subspecialty outside abroad, it's dependent of your head of department, and also it dependent of your choice and your vocation. You want something, I think, as I said in my talk, is that job is vocation. You have to look for, and with the help, I'm sure here that all the head of department, at least in Morocco and also abroad, my dear Kazadi, he's here. He's always sent some fellow to Belgium or outside in USA maybe, or others. So it depends mainly on your head department than Moroccan society.
So please, I think that our
Yes, sir.
friend is ready.
Yes,
Go
sir.
on, Dr. Jimoh.
All right, okay. Good evening, everyone. I'm Jimo from Nigeria. My presentation is the testimony on the WFNS Rabat Training Center. That is my experience. It is an irony that I'm here to speak with this great audience. It is understandable. We are celebrating 20 years of setting up this body, and it has benefited everybody greatly, as has been enumerated earlier on, and I'm particularly a beneficiary, and I want to say something on the organization and what has come of it in the last 20 years. Let me start by appreciating all my teachers from basic school to current level. I also appreciate my classmates and colleagues. I'll talk in this outline. Now, there is a saying that achievement is for those who dare to dream big. So I would have presented this topic as dream, but it's not appropriate. So I think from here you can you can pick up this topic as actually the essence. Now, if you are going to dream, do it big. Dare to live the life you deserve. Now, achievements are all based on hard work, hopes, dreams, aspiration, and facing reality, because it's not always that your hard work will pay. Face reality. Now, my dream of venturing into the specialty of surgery or neurosurgery actually started over 30 years ago while I was in medical school. Now, the next slide is my yearbook. This is my yearbook. I was a class president on, I don't know, the cursor is not working here. Okay, yes. Down there is, the third line is future ambition, is to become consultant neurosurgeon or medical biostatistics. I always have double alternative, second alternative. In case that one doesn't work, I pursue second alternative. But actually, I always make sure I pursue the first one tenaciously. Now, the challenges in getting training position was much, because training positions were just two in Nigeria, Lagos and Ibadan. When I got to the stage of going for my neurosurgery training, I couldn't get one. So I transported myself to Ghana to get a space. And I was given admission letter, but with a bill to pay 8,000 per annum. And I couldn't afford that. And the institution was not ready to pay for that. That's my admission letter, if it is clear. And it was clear that I have to pay 8,000 per annum. Now, from April 2001 to April 2002, I couldn't still get a space. Now, I joined Bibi Shehu in November 2002, and he just returned from the UK 4 years earlier, and I was his first resident. Now, he kept on admonishing me and giving me hopes, because he doesn't have accreditation then. He wasn't having accreditation. So when he went to the UK, he bought a book written by Brian Jennett, Basic Neurosurgery, and he wrote on it, "Dear Jimo, keep dreaming on it until it becomes a reality." I kept that book up to today. This was June 2001. That is Bibi Shehu in the center, Nasiru, and myself were the three. And surprisingly, we are the three new professors of neurosurgery in northern Nigeria of more than 120 million today. Now, bigger dreams. People keep on dreaming. I screenshot this from a program of event. Somebody dreamt for himself, dreamt for his institution, dreamt for his country, and dared to dream for the whole of Africa. And that is Professor El-Khamlishi. Now, like I said, he dreamt so much for Africa based on his research. He has presented a paper earlier on that this is what he hopes for Africa. And that's Professor Zari there, while he was giving him some medal in, I think, France. Thank you. So now he dreamt for Africa, that's the whole of Africa. And there, that was my first week in hôpital de spécialité from Nigeria. The dreamers, I put it in parentheses because dreamers can be, you think somebody is just sleeping and just thinking of something else. Professor Kamlishi, big dreamer. Professor Majid Sami, like he presented earlier on, was a big dreamer. And His Majesty, the King of Morocco, a big dreamer because he thought he would provide his country and his people for the training of African neurosurgeons. Now, in 2005, I came to Morocco after 3 years of training with Bibi Shehu. Now, the training was intense, both and in Africa, Morocco, by Africans, that's the resource persons here, and for Africa. The testimony is that it is full of clinical works, intense supervision. The bosses, they shout. They shout a lot, and it's very, very intense, and you are scared to make mistakes. It has a lot of integration, cooperation, unlimited exposure, unlimited. I mean, even the scrub nurse will say, Abdullah, scrub. You know, even if you are not on the list, scrub. You know, it was so gratifying. Where could you get that? Hands-on. We're exposed to research, leadership training, like Professor Elabadi just talked about leadership. Yes, we're taught to lead. Then hands-on, as I said earlier on. Now, a lot of things will be pictorial. Unfortunately, no pointer. These were when we were young people. Majuba there, Adil, you know, a lot of people. And let me mention something on that slide down there. That's Professor El-Wahabi. You know, he will remain in the theater. I operated craniopharyngioma once with him. 3 hours into the operation, he turned to me, Abdullah, what do we do? I said, sir, let's close and go. And we spent another 6 hours, that's 9 hours. That's to show you that neurosurgery is intense, and it has become my habit. Now, I put that slide on surgery because we do a lot every day, and I was exposed. My little time stay here was as if I stayed 10 years, probably because of my interest. I met, during the Marrakesh meeting, I met the African neurosurgeon. I think Professor Kalangu is somewhere there. Then the icons of neurosurgery. And I don't know if Dr. Muna is here. She took me to Emil's Chill, 10 hours drive from Morocco, from Rabat, for the marriage festival. So meaning I came to Morocco to learn everything within that short time. Culture, everything, meals, friendship, and this friendship has remained all along. This was at Marrakesh neurosurgery meeting before the Congress. I'm sure Professor Wazazi, Professor Ben Ali, they are there. I presented something, they were the ones moderating. I'm sure they are not aware of, they didn't notice this. And a great mentor is Professor Wahabi. I tell my residents, I came with 2 of my residents, that he does surgery like he's playing music, you know. And I'm sure seeing you, they realize that, I mean, what I talked to them about. The other pictures are when I was being sent away, and Professor Kamlishi had to fly all the way from Brazil to attend that. Thank you so much. Then at PANS Conference 2006, Professor Kamlishi came with all his contingent to Lagos. That's myself and Nasiru flanking. Now, let me take a slide on this great friend, a very selfless human being, and a flatmate, Dr. Mujib Balanda. He was such a wise person. We're in the flat together, he prepares the meal and asks me to eat before he eats. He's such a fantastic person. It's unfortunate that we lost him. May his soul rest in peace. Now, when I returned to Nigeria, I got an appointment into Ahmadu Bello University Teaching Hospital, Zaria. It's the largest university in Nigeria. It's somewhere in the center. As at that time, there were less than 20 neurosurgeons in the whole of Nigeria. That was 2000, sorry. I got Dr. Obande to be with me. I brought him here in 2007 because I made a point of duty to always take my residents around. Now, that's where ABU is in Kaduna State, Sokoto, Kano. The training centers, there were 2 before, are now more than 11 in the whole of Nigeria. Now, out of my mentoring, 8 people have finished neurosurgery. They were trained in a lot of places, partly with me as well. The ones in black are the ones with me now that have been retained, and we are doing fantastically well. And thank God, I was promoted to the rank of full professor about 2 years ago. I'm sure I'm the product of this program that has achieved that. Nasiru has been promoted as well. So we thank you for us living our dreams. Now, recently I was given a fellowship, AMCI, CNRNS Foundation, Hospital de Specialization, and I was able to get a diploma in stereotaxy, which we are working to put to use. Now, a lot of other things will be pictorial during the fellowship with fantastic friends. Now, these are the 5 residents that finished last year. And 3 are with me, employed, and 2 others are somewhere in Abuja working. They are fantastic guys. This is during the accreditation of West African College of Surgeons to my hospital last year, where they gave us some accreditation for training in neurosurgery. This is a picture of all specialties in surgery. Mine is neurosurgery, and the assessor is Professor Udo. That's the one sitting at the flank there. And they gave us some accreditation for training in neurosurgery as well. Now, I currently have 7 residents, not fully taken, because we are looking for places beyond our capacity. We are looking for places to put them. The ones in blue are the ones I brought along with me. That's Dr. Abbas and Usman Abubakar. Now, the training is, I try to translate it, it's also very intense as well. We put a lot of things into place. This was at the final fellowship exam of West African College of Surgeons in April. I'm sure you recognize Professor Hueblam, Professor Shokumbi, Jude, and all that. These are the 4 candidates that passed the exam at that sitting. Now, I was advised by Professor Awahabi and Professor Kamdish that when I go back, I should build a team. And that has been the issue. We're trying to build a team. Now, during our last National Neurosurgery Congress, November last year, I sponsored my 2 peri-op nurses to come along with me, because we organized a kind of workshop for the nurses as well, and they participated, and we hope they will integrate and get things better. We will do others as well. Now, this is my newly renovated accident and emergency. That is Professor Dr. Raji doing endonasal pituitary surgery. This is how the wards look like now. It's fantastic, really. Now, my advice to other people and to the ones coming is you must keep the dreams of the founding fathers alive. Self-development. You spend anything to self-develop yourself. You must be selfless. You must mentor and help. I give financial assistance to people. It's very important. They might be withdrawn. Make them family members, and we go along together. Build neurosurgery family locally and around the world. And one of the things is that last year, which is going to be annual, the consultants, the residents, we must have a dinner at the end of the year so that the family, we understand where that you are not in the hospital 24/7 for nothing. Yeah, we sit to share experiences together. This gave me an opportunity to be at INI with Professor Majid Sami, who spoke earlier on, and that's him with Amir Sami and 2 others. Now, I have a picture of somebody there. In the picture, he was standing next to me, and sometime in Chicago we met, and we behaved like kids. We were just shouting, you know. That is building family all around. We're just from Cote d'Ivoire. I attended their meeting, and there, Professor Sanusi is sitting there. I was a faculty there, and the people that were trained here that were there, which is to my delight, are all these: Kizito, Koulibaly, Sogoba, Daora, Jubairu, Kinata, Olivier, Milena, Achille, Dao, and myself. Earlier on, we were in Kinshasa, 2018 and 2019. That's the dream of the founding fathers that we are living. Now, we have challenges, of course, but how do you go about solving the challenges? These are my challenges. How do you go about solving the challenges? Which I call the way forward: dedication and commitment, reach out. Professor Wahabi advised that neurosurgery practice involve reaching out. He gave me this advice 17 years ago when I was leaving, and it's been in my mind. So you have to reach out to politicians or whatever. Then training. I have attended almost all the WFNS Rabat Training Center conferences, because the day you stop training, that's the day you stop getting wise in what to do. You must keep learning. Even the masters that are talking to us, they are learning. What about you? June 2021, I traveled to Rabat with the deputy governor of my state, and we talked about stereotaxy and gamma knife. It's still on discussion, so that's the way to go about it. More assistance from senior colleagues on fellowship training and short-term training of my residents, if it is possible. Why not? More specialized training of sister specialties, because we might have problems, pathologists, radiologists, and all that. We might not be talking at the same level. We collaborate with ENT, cardiothoracic, maxillofacial surgeons, oncologists, plastic surgeons, ophthalmologists, and radiologists. Now, the slide up is me and the ENT surgeon when we do endonasal surgery. This is not in my hospital, it's a military hospital, and I run neurosurgery service there. So he brought it, and why not? We do fantastic surgery with it. Then with cardiothoracic surgeon for access to the chest. This is my hospital, the gate, and this is how this hospital look like. The 3 images down is the center that the chief medical director has come to my aid. He is building it for neurosurgery. It's going to be fantastic. It's a big building. This is how it looks like. Now, to the past and present residents in the hall, sorry, if you do me a favor, can you stand up? Let's applaud these wonderful ideas. Please, can we all stand up? We really appreciate you. And I got this picture when you are snapping now. Thank you so much. Thank you to Professor El Hamlichi, the WNS Foundation, His Royal Majesty the King of Morocco, and the good people of Morocco, who are our friends and our patients. Thank you so much for listening. Thank you so much.
Thank you very much. I must say, Professor Jimoh, for your presentation, for your recognition, for please, for having given to all of us your paths, your way forward with your training either locally in Nigeria and in Morocco, and congratulations for the position you are now keeping at your university, at your hospital, and also for your contribution to the African neurosurgery, to the regional meeting, all what you have told us. And it goes without saying that you are an example of all your colleagues who were trained in WFNS Rabat Training Center. The next one, please.
Yes, may I call Dr. Natalia from Republic Democratic of Congo. He will speak about neurosurgical activity in Republic Democratic of Congo. He's here? No? He's not here.
So go to the next.
Yes, go to the next. No. The next is Dr. Dakhla from Malawi. He will speak about neurosurgical activity in Malawi. please, for the next presentation, give at the technician your presentation, please, because we are late and we had to short this delay.
Good afternoon, ladies and gentlemen. I'll present on neurosurgery in Malawi. I'm an alumni of Rabat, WFNS Rabat Training Center, and I trained in FACE under Professor Shawi. Hence, I have this opportunity to give you a talk of what is neurosurgery in Malawi. I'll talk a little bit of where Malawi is, a bit of history, what is currently the status quo, and then looking at the future. And of course, we'll call for collaboration, and then we'll acknowledge as we conclude the presentation. So Malawi is a small country in Central Africa, stretching about 900 kilometers in its length. It's bordered by countries like Zimbabwe, Mozambique, Tanzania. For those of you who know those countries, I know most of you may not know. The capital is Lilongwe, and the population is almost 19 million at present. Our currency is Malawi kwacha. If you come to Malawi, don't touch that animal because it's an endangered species called a pangolin. The history of neurosurgery in Malawi cannot go unnoticed. If we don't mention Dr. Ngantafu, who was trained in Germany, deceased now, and of course Professor Adeloy, who is from Nigeria and is acknowledged for inventing the Malawi shunt when the need was rife at the time of his practice. As at present, the status quo of neurosurgery in Malawi is that there are 4 neurosurgeons against a population of 19 million, and I have 3 colleagues, making 4, including me. As of now, of course, we have got local training, which is accredited by the COSEXA, that's the College of East and Central African Surgeons, and the local training started in 2020, and as of now, it's being conducted at in the commercial seat of Blantyre, and as at present, we have got 5 residents in training, and 2 will graduate as early as next year. A bit of the profile of the neurosurgeons who are in practice at present. We have got Professor Kamalo, who was trained in Durban, Republic of South Africa, and is a fellow of the COSEXA, that's the regional block that is accredited the training local in Malawi. He's the current head of department and also the chairman of Blantyre Institute of Neurological Sciences, which I fare a part and parcel of. So he has worked very hard, Professor Kamalo, to set up the local training and to reach the extent that has been accredited by the regional block. He's also got funding from support from University of Oslo, Norway. And we have had visiting surgeons, lecturers from America, Hungary, who also help him to conduct some complex surgeries that we can't do locally. And at present, the institution is equipped with a microscope, flexible endoscope to conduct endoscopic surgeries, especially the ETVs. And of course, the collaboration from Oslo has also ensured that the local residents have got online classes from lecturers from abroad, especially during the time of COVID, which has become a reality at present situation. And of course, exchange programs for both the local residents, the nurses and anesthetic personnel, as a neurosurgery practice does not necessarily rely on the neurosurgeon alone, but it extends to other allied personnel. And is working hard towards telemedicine, whereby we have to interchange with neurosurgeons across the country and in the region and beyond, so that information is passed across and becomes part and parcel of the global neurosurgery, part and parcel of contemporary practice of neurosurgery. Dr. Keller Mendez was trained in Addis Ababa, Ethiopia, and is a fellow of COSEXA and currently works in the capital, Lilongwe. We have got Dr. Mpando, who is my colleague, who was trained in Marrakesh by Professor, the professor who is here, the eminent professor, and he's very proud of him. I think he had to send me this picture to show that despite that he's in Malawi, he still remembers there's Professor Benali for training him, and he's a good surgeon, and he sends his regards. Our arrival in Malawi rather, after being trained here, made a big change to the practice of neurosurgery, because I think we are becoming the main surgeons doing the spine surgeries. Before, they were the orthopedic and trauma surgeons who are doing the neurosurgery, especially the spine surgery. So we have inherited, because the orthopedic surgeon who was doing it has so far retired. So we have taken over, and so far, so good. So we have got 4 central hospitals. The main one is Queen Elizabeth Central Hospital, where the training is being done. And as of now, there is a microsurgery and the neuroendoscopy. However, the endoscopy is a flexible endoscopy, able to do the ETVs, but we can't do the other endoscopic surgeries like pituitary. 2 consultants, 5 residents. There's a CT scan which is working. The MRI is yet to be repaired, as it's not working properly as of now, but it will be fixed soon. Almost 450 cases annually, especially the childhood hydrocephalus and spina bifida, but other cases like spine and basic craniotomy, especially trauma cases, are also being done. Kamu Central Hospital in the capital is also offering some minor neurosurgical procedures and simple craniotomies, and it will soon become a teaching center. It benefits because there will be an establishment of an institute with support from Norway, 2 investors from Norway, and other partners, including the government, where there will be an institute of neurosurgery and orthopedics, Lyon. And in this complex, we have in-house imagery like CT and MRI. Zomba Central Hospital, which I happen to be close to, as I go there as a visiting neurosurgeon, we so far provide the basic neurosurgical general cases, the hydrocephalus. We treat the headache injuries. However, the CT and MRI is not available. We have to send our patients 60 kilometers away for a CT, and the MRI about 300 kilometers away. And there's another hospital far north, which provides basic neurosurgical services, but limited to childhood hydrocephalus and the spina bifida. However, it doesn't have the CT and MRI, but they are yet to acquire it. And then the Army Hospital, which I'll soon be transferred to, is geared to open a neurosurgical center in November this year, and I'll be the neurosurgeon there. It has already bought an MRI and a CT scanner. It will be in-house, and it's eager to acquire an operating microscope and endoscope. Hence, my need to do a fellowship and mentorship in this, so that I provide the services locally. And of course, it will also be a center of collaboration with the local College of Medicine, training undergraduates and postgraduates in various disciplines in surgery. When you look at the future, despite that we are 4 at present practicing neurosurgery, but when you look into this picture, you see that most of us are young. We are below 40. So it's a big investment, because it means you have a lot of time to practice. This is a picture which was taken when I just graduated, and among this picture there are also 2 residents which will be graduating next year. So among these 2 local residents, there is 1 woman and one gentleman. So it's a 50-50 gender ratio for our residents. So the future, indeed, as I've said, is bright, because the number of neurosurgeons, despite that is small now, it's increasing. And then there's also steady increase in the acquisition of neurosurgical instruments. And investigations which tend to be a challenge, like CT and the MRI, they are becoming more available. That is boosting our diagnostic capabilities. And this local residency, which has become available in Blantyre, and also soon to be open in Lilongwe, will become a very useful tool, because as we know, as we provide residency training, we also provide local help to our patients by the residents, which are in bigger numbers than maybe the teachers and the professors who are available. And this project that I've talked about, the Lion project, will also expand the capabilities of neurosurgery in the country, because it will be a center of excellence in terms of training of neurosurgeons and also other allied health sciences. Indeed, we need to call for collaboration, because as a country, we need support. I think so far, we have been able to provide the basic neurosurgical services, as we have been taught here in Morocco. However, I think we should also look at expanding our skills to the skills of scar-based, vascular, pediatric neurosurgery, spine surgery. I think the time has come for us to advance in those domains as well. And indeed, we need to equip ourselves with microsurgery instruments and the neuroendoscopy so that we can provide more complicated surgeries. And the training of allied sciences cannot be underestimated. Neuroradiology, neuroanesthesia, exploration in neurophysiology, the EEG, EMG, ENG. I think those things have just to be provided. At present, I don't think we are doing it locally in the country, making our domain of practice a bit limited. Telemedicine, I think COVID has taught us a lot of things because their time comes when we need to meet as we are done now. We were not able to do so. So if we advance our technology in terms of telemedicine, we'll be able to discuss these cases with our professors, our former professors, our colleagues, and those maybe we have never met, especially those who are experienced in other domains. So telemedicine cannot be overemphasized. I think we just have to do better and make sure that it becomes a reality in our setup. Just as a background, I graduated in phase. I'm still in the military. I'm a rank of a colonel, promoted last month. I'm a visiting surgeon at Zomba Central Hospital and also participating teaching in Blantyre Institute of Neurological Sciences. When I went back home, I was met by reality. This is her childhood hydrocephalus, a case that shouldn't happen if we have got a good number of neurosurgeons. Advanced hydrocephalus, maybe the best we can do is maybe to do a palliative ventriculoperitoneal shunt because already damage has been done. Tumors, yes, we do them. When I went back, I think I operated on this patient. It didn't turn out well. I think the overzealousness of training, you go back to operate on a patient, maybe you have not prepared very well. But the situation was I had to operate with the professor and he has gone away. I didn't know the setup. The setup was a little bit tricky. I didn't know where to get the blood. I didn't know who to call. And my language had changed. I had trained in French and in Arabic, and then I was back in the English setup. So how do I call for help? So these are some of the cases that we have done, cervical fixation of the cervical fractures, occipital encephalocele. We have done trauma flaps. This is our day-to-day braid with a good satisfaction. We are fixing fractures. Of course, we also teach our residents intraoperatively. However, we are limited to do scar-based surgeries because of lack of instruments, equipment, and of course expertise. We need to be mentored. So some of these cases, we have to send them as far as India, which is tedious, expensive, and there's very poor follow-up. In conclusion, neurosurgical care in Malawi is in steady increase. It's evolving very well in terms of increasing the number of neurosurgeons and radiological investigations. However, we need more support to train more and acquire more equipment, and especially to get some knowledge in other specialties like vascular and scar-based spine surgeries. Of course, there is always hope when you make a difference with limited resources in a constrained environment. Thank you so much. However, let me acknowledge the following. I think Professor Majid Sami, Abdul Salam Kamlichi, Professor Shawi. I think I can't emphasize that much has been already said. Professor Besmoud, Professor Damien Bresson, I think they are great teachers. They're great teaching staff in phase. Of course, the Commander of Malawi Defense Force and the General of Military Health Services for giving me the opportunity to come this far. And Professor Kamalo and Brigadier General Air Commodore Onyechi, retired, who wrote my recommendation to do training in Morocco and the Africa 100 project. Thank you so much.
Thank you, Dr. Dakhla, for you.
And both of you, with your colleague, Dr. Mpado, I think, yeah, Dr. Mpado, were trained in Marrakesh and in Fez. And you came from English-speaking country to be trained in French-speaking country. I want to point out that because it's a pity our friend Azhari is just going. Professor Azhari, he's just going. Professor Azhari is secretary with French-speaking society. And I was always repeating to my colleague, French-speaking neurosurgeon, and mainly French in French society, that one of the advantages of the WFNS Rabat Training Center is to create this mixture between English-speaking and French-speaking neurosurgeons in Africa. And that will, I hope, slowly make the two communities speak in both languages and make disappear also some kind of special division which was left in Africa. Dr. Karango is reminding as me many things about the last 50 years in this issue. So I congratulate either Professor Ait Ben Ali, who is here. Shawi is not here, it doesn't matter, and for their collaboration in this WFNS Rabat Training Center. And you also, I hope that you still remember some French.
Oui, très bien.
Because I would like that in future you become, with your colleague, a member of the French-speaking Society of Neurosurgery. Okay?
Oui.
So prepare your presentation for the next meeting of this society. Professor Azhari is going here to tell you how to make it. Sorry.
Thank you.
Great idea, Professor Khamdishi, as usual.
Let him call the other after Lamino, who is.
The next presenter is Dr. Olivier Wambi, neurosurgery activity in Chad. He is not around. Then the next person is my testimony on WFNS Rabat Training Center by Dr. Adeniran Bankole. Yes, he's here. You have 10 minutes.
Pour diffuser, c'est bon?
C'est bon, c'est l'affichage.
Juste
les
okay.
deux. C'est bon? C'est en arrière, c'est en avant.
Okay.
I want to know if the last two presenters are around. Hmm? Oh.
Okay.
The Bambino Sinclair. Yeah, that's him. It's Ekwele Mbaki that is not around.
Can I start? Okay. Thank you. Good afternoon, dear masters, dear colleagues. It is a pleasure to me to present my testimony on the WFNS Rabat Training Center, where I just completed my training. I am originated from Benin in West Africa, a beautiful country of 12,500,000 inhabitants, with 9 neurosurgeons in 2016 when I applied. I sent my application for the WFNS Rabat Training Center. I graduated at Dakar, Senegal in March 2016, and then I applied for WFNS Rabat Training Center with WFNS Foundation Scholarship. Under the recommendation of my mentor who trained me in Dakar and who I did my thesis under Professor Saho, who recommended me to Professor Al-Khamdishi. And I got positive feedback after 8 months awaiting and selected for the WFNS Rabat Training Center program. I arrived in Rabat in Morocco in January 2017, enrolled in the Faculty of Medicine of Mohammed V University of Rabat as neurosurgery resident, started in February 2017 in WFNS Rabat Training Center my training, in this both beautiful hospital of specialty of Rabat and Ibn Sina Teaching Hospital in Rabat. My training journey. I studied in neurosurgery department of hospital of specialty of Rabat. I did 4 semesters under supervision of Professor El-Wahabi. I did another 3 semesters under supervision of Professor Makili in Ibn Sina Hospital teaching, 1 semester in neurology department under supervision of Professor Gragi, and 2 semester internship abroad in neurosurgery department of Tours and Annecy in France under respective supervision of Professor Velut and Dr. Mendez. And I have also opportunity to do an interventional neuroradiology fellowship. The workload as neurosurgery resident is like we did a shift in emergency and neurosurgery department to the junior steps to the senior and the chief residents. We have average of 2 times per week in OR for elective case, involved in the lecture activity in the department, teaching medical students, daily and weekly round on department staff meeting, and participation and presentation cases also in neuroscience center with Professor Hamlishi. We present the cases, we participate also on the discussion. We participate also on the continuing medical education workshop, WFNS live course, seminar, Moroccan Society of Neurosurgery meeting, pre-course congress, national, international meeting, congress, and also publication. The achievement was based on the theoretical and practical goals. A learning curve during the training in the both hospital neurosurgery department of Hospital of Specialty of Rabat and Ibn Sina Teaching Hospital. I involved a total of 885 cases within the 8 semester in a Rabat Training Center. 508 were emergency cases, and 377 was elective cases. I also have opportunity to present 8 e-poster, 12 oral presentation. I published more than 30 papers, and also have opportunity to be a member of organizing committee of Beninese Society of Neurosurgery, and also I have 2 awards, international award, and 10 international grant, conference grant. This is just like a summary of my book on the case that I performed. Both pediatric and adult were being managed. A total of 508 emergency cases as cases with depressed skull fracture, epidural hematoma, subdural hematoma, chronic subdural hematoma, spontaneous intraparenchymal hematoma, intracranial operation, cervical anterior approach, post-cervical approach of cervical spine trauma, odontoid screening, thoracolumbar fixation, kyphoplasty, minimally invasive spine surgery, no-invasive surgery, and also EVD, VP shunt, and ETV on emergency. I have opportunity with the learning curve to be involved as senior operator in 70% of cases. About the elective case, it was about 377 elective cases that I did within the 8 semesters in Rabat Training Center. We have a lumbar disc herniation, lumbar canal stenosis, a technique as PLIF, TLIF, MCA pathology, spine and intramedullary tumor surgery. I also learned to do most of the approach, of course, extradurally, as pterional approach for aneurysm cases, AVM cases, meningioma, fossa cerebral posterior, cerebral posterior fossa, convexity skull base, and also I assist also as transsphenoidal approach, brain mapping, awake surgery, stereotaxis biopsy, and also pediatric neurosurgery such as myelomeningocele, craniosynostosis tumor as well. And I was also involved with the learning curve, such as 43% of most of the elective cases that I did. The achievement is I want to emphasize that in WFNS Rabat we have opportunity to learn early and to have skills and high possibility. At the end of my at my second year of residence training, I has full hand to manage as well emergency cases, and also to did for the senior professor surgical extradural approach as well in pediatric and adult. In my third year, I went to Ibn Sina Hospital Specialty, that I improve all these skills that I learned 2 years ago and become a senior resident and improve my skills in spine surgery. I also continue to improve my skills of spine and skull surgery in my 4th year, and also in my 5 years I learned to accurate all the procedure as chief resident and also did my dissertation. And beside that, all the 5 years, I have opportunity to present at the conference. I would like to thank very much Professor Hamlishi to support me every time. And also, I learn also to write, to review paper, and to edit and to publish. It is very important to me to emphasize that Professor Marshuba Butterbush was one of my mentors who teach me step by step till the position of the patient to did the approach. And he was many times in the upper OR and to showing me how to do and where to go till the beginning before she will go to scrub and come to do the rest intradurally. And I would like to thank Dr. Rifi also. And this is just a testimony of what I did. I was involved in a lot of cases within my residency training. And also, I went sometime in Angio Suite with Professor Butterbush to did some case. And I participated of a lot of cases, a lot of congress as I told. And very thankful for Professor Hamlishi to always support me to attend all these international congress and workshop course. And I published, this is the last that we did with Professor Butterbush about intracranial cavernoma, about 20 years of experience of our hospital specialty of Rabat, with the pioneer of neurosurgery, Professor Hamlishi, and other papers here that we can see. And I would like to acknowledge very, with all my heart, Professor Hamlishi, Professor Al-Wahabi, Professor Butterbush, Professor Makili, Professor Aha, Professor Fatemi, Professor Melraoui, Professor Hamama, Dr. Rifi, Dr. Hakou, Professor Oudriri, Professor Gizad, and all the members of UPR of Rabat. And also my mentor who trained me and gave me this motivation to do neurosurgery. And also my Beninese seniors who always support me and call me to know how he's doing and give me a support and moral support, and so my parents. And to conclude, my journey was not easy, exciting and prolific. I read that myself, train more my mindset, learn local language. I was involved in the majority of the training activity of WFN Rabat Training Center. I received mentorship and I'm thankful for that support and great training. And I learned to become a neurosurgeon with the goal to continue and become a hybrid neurosurgeon and to go back to my home country in Benin. So I will just finish to this, that excellence is an art that can only be achieved through constant exercise. We are what we repeatedly do. Excellence, therefore, not an action but an habit, but a habit, as said Aristotle. And shukran, and thank you very much. And happy birthday to my center, to my training center.
Thank you so much, Nuruddin, for that exciting paper presentation. Yes, you've been an exciting young man to me since the first time I saw you. Congratulations for all you've done.
Thank you.
So I think the last paper will be by Dr. Kinita. That's Dr. Sinclair. He's going to present on tandem spinal canal stenosis, experience of CHU-B. That's Brazzaville, I think. You'll have 10 minutes.
ici. Yeah. Bon. Yeah. Okay. My apologies, I will to speak in French, but my slide is in English. Yeah. Les tandems, les sténoses rachidiennes en tandem sont des atteintes simultanées, sont des sténoses simultanées de deux régions du rachis. Ils sont caractérisés par l'association des signes spinaux, radiculaires et médulaires des membres. Et leur prise en charge est controversée. Et nous rapportons donc notre expérience, l'expérience du service de chirurgie polyvalente du CHU de Brazzaville. Donc, nous avons réalisé une étude rétrospective sur 16 patients porteurs d'un tandem rachidien. Et sur une période de 10 ans, nous avons analysé donc les caractéristiques cliniques, démographiques, paracliniques, la stratégie thérapeutique et l'évolution. Et l'évolution a été évaluée sur la classification de Nuric comme en considérant que l'amélioration est le changement de grade, du haut grade vers le bas grade. Voici la classification de Nuric. Et donc, sur 10 ans, nous avons pris en charge 16 patients sur 1164 patients porteurs de pathologies dégénératives, donc 1,6 cas par année. Et le sexe ratio était de 1,3 et l'âge moyen de 57 ans. C'est ce que nous retrouvons effectivement dans la littérature. Donc l'incidence étant de 0,12 à 24%, surtout l'incidence étant plus élevée dans les populations asiatiques. On retrouve aussi une prédominance masculine, mais l'âge moyen étant plus élevé que chez nous. Voici donc, les patients vont consulter dans 87,5% pour des rachialgies et des névralgies, et pour dans 93,7% des cas pour des claudications neurogènes intermittentes. Et on retrouvera dans 87% le signe de Babinski positif et le signe de Hoffman dans 81%. Et c'est l'examen clinique. Et donc l'atteinte sera souvent cervico-lombaire dans la grande majorité des cas. Et surtout prédominant dans la région C5, C4, C5 et L4, L5. Donc, cette association, l'association des signes d'atteinte rachidienne, spinale et lombaire justifiera la réalisation d'une IRM panmédulaire. Donc, nous avons généralement réalisé pour le rachis cervical des abords antérieurs et pour des rachis lombaires, généralement une laminectomie. Ce tableau résume les deux attitudes que nous avons dans le service. Donc, la prise en charge en une seule étape ou la prise en charge en deux types de chirurgie avec les différents paramètres, le saignement, qu'on remarque un peu moins important quand nous opérons en deux temps qu'en un seul temps, et la durée d'hospitalisation qui est relativement plus courte, mais en deux épisodes de 4 jours d'hospitalisation. L'intervalle moyen quand on opère en 2 temps est environ 4 mois. Donc, nous notons donc l'amélioration significative de nos malades qui, dans la plupart, qui pour la plupart s'améliorent. Et donc, ce tableau résume les avantages et les inconvénients de la chirurgie en 2 temps ou en un temps. Bien sûr, il faut tenir compte du choix du patient après explication, de l'âge du patient et des comorbidités. Bon, c'est un exemple illustratif de ce patient de 72 ans qui était arrivé grabataire, Gnurix 5 en préopératoire, que nous avons opéré en un temps après environ 4 mois d'intervalle et qui s'est amélioré. Après 12 mois de suivi post-opératoire, il est passé à Nuric 4. Donc, en conclusion, les tandems rachidiens spinaux c'est une entité rare que nous rencontrons dans 1,6 cas par an. L'association des signes médulaires radiculaires impose la réalisation d'une IRM panmédulaire. La chirurgie est souvent réalisée dans un ordre crânio-caudal et elle peut être réalisée en un seul ou en 2 temps, mais notre préférence va dans la réalisation de la chirurgie en 2 temps parce qu'il y a moins de morbidité. Et quand elle est réalisée tôt, les malades s'améliorent. Je vous remercie. C'est la citation de l'article.
Thank you so much, Dr. Kinata. And that's the last presentation for this session and for today. We thank all the presenters, including myself, of course, for the presentations. I guess we have 1 or 2 minutes if there is anything, if there is any question concerning the presentation. Yes, microphone for Dr. Yu, please. Any other person? Let's take. They are bringing. Any other person? Raise up your hand.
Thank you very much. I want to talk about this global neurosurgery. It's one unfortunate that the professor that presented that topic is not among us here. It was the first topic presented online. So I have a chance to follow this global neurosurgery many times, and I can say they have very interesting branch concerning research and scientific publication. So I don't know if the Rabat Training Center have done it already, or they are putting together with them some program for the undergoing training in Morocco in general, for us to have a chance to collaborate with this global neurosurgery in the sense of the publication and scientific paper writing. That was my first concern. The second one is a question. During the presentation, I can't remember who talked about that, but I think it was Professor Hamlichi that presented that case. He said till 2016, we've got a great number of neurosurgeons in sub-Saharan Africa, and these young neurosurgeons are this increasing of the neurosurgeon in sub-Saharan Africa is also due to the fact that they have put in place a local training program. I think that's what we say. So I would like to know what is the relationship between those local training program and the modern training program that of Morocco, if I can say it that way. Thank you.
I think your last question, you are asking. Yes, I said that this increasing in a number of neurosurgeons in whole Africa is because there is these regional centers, but also because there is national training centers. and that the number of these national training centers are increasing. And of course, this is the main, the most important, I think, effort which can increase the number of neurosurgeons in future. So what you asking, please?
Yeah, what I was asking is that those young training centers, local training centers in sub-Saharan African countries.
Where?
In sub-Saharan African countries, in different countries in Africa right now, the new training centers.
Yeah.
I feel to make it better, maybe they should have some other relationship with the Moroccan training centers in the sense of fellowship. Maybe why not send their residents, or why not come back to Morocco for fellowship, for skull-based or vascular, apart from what is already done. That is what I was asking.
Yeah, this joined your first remark also regarding the research. I think that what can be developed with all of you who are today in starting their department or their services in sub-Saharan Africa is to try to make some clinical research on mainly on epidemiology to exchange the information, because this is the most important aspect at the beginning. It helps you to convince the local health planners to consider neurosurgery as some important specialty, and it will help all of us in the continent to see what is the importance of each pathology. You know, 30 years ago, the main we were considering, this was in the first survey we have did, it's shown us that the first pathology was the head trauma and spinal trauma. But today, I'm sure that it's changing. You have seen the discussion yesterday regarding the vascular pathology, which was inexistent 25 years ago. So this is this research on clinical and epidemiology of situation of neurosurgical pathology is very important to be done, and I advise you to start, and all young colleagues to start by doing that in your department. The exchange regarding the fellowship, yes, we are doing our, we have started, and I think that Abdullah already mentioned that he was here in Rabat last year, not last year, 2 years ago, just before the pandemic. He fly from Morocco with the beginning of the pandemic, without finishing the 15 days of his training, who were already not completed. He had a fellowship for 6 months to be trained in stereotaxy and radiosurgery, gamma knife radiosurgery. And I think that it allowed him to master stereotaxy at least, and then he's going to be back maybe to continue for radiosurgery. We had also another fellowship this year for one colleague from Nigeria also, who was Dr. Okvi, who was sent by Professor Obgulam. So this is open when we have the possibility. And I know that the international agency for, the Moroccan Agency for International Cooperation is also granting some scholarship for many of you. They know that for basic training, but they have given their agreement also to do it for the fellowship with a limited period of 6 months to 1 year. So this is started, but I think it should be increased, and maybe this can also done in other African countries with department who are advanced in neurosurgery. Professor Karango is here. Colleagues in Nigeria also, in all North African countries, in South Africa. We had just to show what I mean. This statistics and epidemiological figures you are collecting, you have to show them to to the colleagues in different meeting, and then this fellowship I think can be improved, and we can create more than that to answer the needs of the colleagues. Yeah, I think that the session is sorry. Yeah, we finish. Yes, pardon. Yeah, our session is come to the end. Thank you for the young colleagues, speakers, and thank you for my colleagues, the two co-chairmen. And this was the second day of the 13th WFNS Rabat Training Center Mohammed V University course, and we have finished. Of course, oh yes, our colleague Karen Go wants to say something.
Yes, a very short comment, but he made the mistake to tell me, he didn't tell me the timing, so just said short. So that's you can discuss about that. Thank you very much. I'm so delighted to see how neurosurgery has progressed in Africa. You know, when we started, we were just dreaming. We didn't believe, you know. It's like a father and a mother. All of a sudden, they see that they have children, grandchildren, and so on and so forth. It's like a dream come true to us as well, you know. Yeah. And we used to rely on foreign countries to try to train our own people. It was so slow, and a lot of conditions, and this and that, and so on. And one day, we met in Harare, in my house, and we were eating and drinking, but we were not drunk yet. And we said, why don't we start ourselves to train our own neurosurgeons, you know, and one by one. And we took it seriously. He came to Morocco. He had the opportunity to start because the conditions were there, but the conditions were not there. He organized those conditions. Later on, also, I managed to organize, and so on and so forth. One day, we'll sit down, you know, around the fire work, and then discuss and tell you what was happening. The second thing I wanted to say is that Africa shouldn't be ashamed to say that we are behind. Remember that the first neurosurgical operations were done in Africa 3,000 years ago. Egyptians, we are Egyptians, you see. And we were doing those. So we started, and events made that in such a way that we came down, but we are not behind. We are actually restarting, you know, to grow. And about the instruments, you know, a lot of countries like Pakistan, India, they are making, you know, instruments. We have engineers in Africa. I think we need to approach them and challenge them. You know, I know in Nigeria, you're very good at manufacturing, you know, spare parts for cars. I'm sure they will be able to manufacture some of the instruments, basic instruments. We should be able to do that. As Egyptians, we used to, you know, all those craniotomy instruments and so on. They were already done those days. So the future is still open. We need just to open doors, dream again more and even more, and you'll see very soon we'll actually catch up. Thank you very much.
Thank you. Thank you, Kazadi. And we close this course with this optimistic statement, and by also thanking all the participants, all the speakers, all the faculty, especially the faculty, and also by thanking the organizers who, of course, organized this course in parallel with the 30th Congress of Moroccan Society of Neurosurgery. Thank you.